meeting to order. This is the weekly finance meeting of the commissioners today, April 28, 2021, appointed hour 1:30, Friday. We'll start our meeting with a review of the minutes of our previous meeting, April 21, and I'll entertain action on those minutes.
I will move to approve the minutes of April 21, 2021.
Moved and seconded, all in favor, indicate by saying aye.
Aye.
Motion carries. Okay, that brings us right to today's topic, which is the County Relief Block Grant recap, the Renew Cumberland program that was one of the first out of the gate for COVID recovery. And we are blessed with the presence of Dana Best, our CFO, Ron Snow, and Stephanie Phillips, all of our finance office. And they're going to cover some of these topics today. So whoever wants to start.
So during the presentation, we're going to do the block grant, and then we're also going to give a quick update on the year-end fund balance. Ron's going to cover the block grant, so I'm going to turn it over to him.
All right, so good afternoon. So before we moved on to other things, we wanted to circle back around and give you a quick recap of the County Relief Block Grant and how things ended up. So just as a quick overview, the Federal CARES Act was established for coronavirus relief fund, which offset necessary expenditures incurred due to the COVID-19 public health emergency. So the federal government direct funded counties with populations over 500,000 in population. The rest of the funding went to states for them to disperse. So what Pennsylvania did was they established Pennsylvania Act 24 of 2020, which provided $625 million in CARES Act funding in the means of block grants to counties through Department of Community and Economic Development. So Cumberland County received just under $22.9 million in block grant funding. So once Pennsylvania passed Act 24, there wasn't much time to get things spent. 180 days to be exact. Not that I was counting. So on June 25th, Resolution 2020-20, the COVID-19 block grant program was passed by the Board of Commissioners, and that established the Renew Cumberland Task Force. Then July 13th, Cumberland County received $22,881,555 from DCD in the form of a block grant. July 16th, what we're now referring to as Tier 1 funding, opened up for grant applications. The applicants were made up of small businesses, not-for-profits, behavioral health, municipal governments, and the county government itself. So the applicants had 2 weeks to submit applications. The grant portal or application portal closed on July 30th. On August 24th, the task force brought a recommendation of funding to the commissioners, which was announced on August 24th. While we were issuing contracts and issuing payments to Tier 1 vendors, a Tier 2 program was established, and that was more focused on small businesses that didn't qualify for the minimum grant amount of $5,000, and also some additional funding for child care facilities. So that round of grant applications opened up on September 9th. Again, it was a 2-week application period and closed on September 22nd. Those Tier 2 grants were announced and approved by the Board of Commissioners on October 14th, and then we had until December 30th to fully incur the expense. So with such a tight timeline, it truly took an army to get that accomplished. I just wanted to kind of give some recognition to the members of the Renew Cumberland Task Force. So the task force was made up of basically 6 teams. So the first team was the small business team. That was Gary Chickatano, paid staff, and members of the Chambers of Commerce. The not-for-profit and behavioral health team was Kelly Meader, the Treasurer's Office, Jack Carroll from Drug and Alcohol, Tim Whalen, and Chris Rafferty from Redevelopment Authority. The municipal government team was Kirk Sommer from Planning, Bob Shively from Public Safety, Stephanie Williams, and Elizabeth Grant from Planning as well. The county team was made up of Stacy Snyder from the Commissioner's Office, Mark Adams from IMTO, John Lott from Facilities, Samantha Cripps from Communications, and Dana from the Finance Office. The compliance team was made up of Keith Brenneman from the Solicitor's Office, Bob DeRosa and Mike Clapsell from the Controller's Office, Stephanie, Dana, and myself from Finance. And the role of the compliance team was really to develop the contracting for the subrecipients, develop subrecipient monitoring, do the DCD reporting, and vet the vendors, the awardees. And then the IMQ team was made up of Mark Adams, Adam Green, and Jonathan Pennon, and they developed the web application portal and web support. So basically, the only thing that's currently outstanding with the Cumberland program is our compliance. And that's the subrecipient monitoring piece. When we developed the subrecipient monitoring, we developed it into 3 levels. The first level being small businesses, and Office of Management and Budget handles for-profit businesses a little bit differently than they do not-for-profits and government entities. So with the small businesses, their application process was a little more detailed, where they submitted tax returns, supplemental schedules, and then Katie was also doing a calculation of what 3 months of operating expenses. So once they submitted all that documentation, Katie was vetting them as they went along. So at this point, once they were signed their contract, we awarded them their grant, we're finished with them, there's no additional reporting or monitoring for us to do for them. The second level was the not-for-profits and behavioral health. And what we did with them was they had a spreadsheet they completed for us where they detailed out by month when they incurred their expenses, and then they attested to us by signing that spreadsheet that they spent the money on eligible expenses. We do have to circle back around with them in the end of the summer or early in the fall. Any organization that incurs or spends over $750,000 in federal expenses is required to have a single audit done. So we'll be reaching back out to those organizations, asking if they had a single audit. If so, provide it to us, and then we'll review it, and then we'll close our monitoring for that. Then the municipalities, they just had an extra step. They also did the spreadsheet, attested to us their expenses, but they are also required to provide us actual invoices and proof of payment of their expenses. Again, Office of Management Budget handles governments and the most restricted level. And again, we'll be reaching out to them to see if they also completed single audits and then go into a review process. Once that is done, then we will be completely closed out with the program. So this next slide is the DCD reporting that we were required to do. So we reported to DCD on a monthly basis. DCD also monitored us. It wasn't monthly, but it was periodically. So that was a form of a Zoom call or WebEx with DCD. The one thing I wanted to point out here is it shows total spend of $22.8 million. We were required to track and spend interest on eligible expenses. For whatever reason, DCD did not want to see that in our spreadsheet, so it's in the remarks section. So it is limited. And then we had our final closeout meeting with DCD on April 13th, 2021, and no issues. So now to get into how we spent the money. The first column, we had 830 applications for a total funding request of $34,260,000. So that was roughly $11.4 million more requests than we had funding allocated. So the teams really had their work cut out for them. On August 5th, the task force came to the commissioners kind of with a framework spending plan. So that allocated $22,395,000 with $486,000 unallocated. In between August 5th and August 24th, some more applications were reviewed a little more closely. So what was end up being approved was $22,488,000. with $418,000 allocated at that point. So then tier two came into effect, and $823,775,000 was allocated for tier two. Then the column in orange is where we finally ended up. So we had our $22.8 million, we had $35,000 in interest. So we had $22,916,570.53 to allocate. And I can happily report we allocated every single penny of it. So $13.7 million went to small businesses for 60% of the funding. $2.9 million went to not-for-profits of 12.78% of the funding. $61,000 went to behavioral health, just over 0.25%. $1.1 million to the municipalities for just under 5%. $151,000 to KDIC, 6.66%, and $4.9 million stayed with the county of 22.60%. So then we'll just get into a little more details on each one of the funding groups and number of awardees. So as I mentioned, we have a tier one, a tier two business grant. The tier one business grant was grants of $5,000 to $50,000, and we had 393 awardees in that group for $12.6 million. Tier two was grants of $500 to $4,999, and that was because we had some businesses, small that didn't qualify for $5,000 in tier one, and also some businesses that missed the application deadline. So we were able to circle back around and include them. And so in tier two, the small businesses, we had 132 awardees for $552,000. We also had 17 childcare facilities that we funded for $260,000. We had 9 awardees that failed to meet the requirements of the grant. So that was 5 that were not willing to sign our contract. Whether they didn't some found out it was taxable income, they didn't want the tax penalty, some just didn't like the wording of the contract. So that was just under $95,000 that we were able to reallocate to other funding buckets. And then there was 4 businesses that had outstanding tax liens. So they did not qualify. That was just under $54,000. 2 of them had more outstanding taxes than we were going to give them in a grant, so it didn't make sense for them to pay their taxes. There was 2, we used every avenue possible to try and get them the funding. We just couldn't make it work. They couldn't come up with the funds to pay the taxes so we could give them the grant. We had 104 not-for-profits awarded for a total funding of $2.9 million, and we had 1 that failed to sign our contract. That was just some miscommunication between the local branch of the not-for-profit and the parent branch. Once the parent branch received the contract, they decided not to sign it. Again, that funding was reallocated. We had 5 behavioral health awardees for a total of $61,000. And then again, we had 1 that failed to sign our contract. And what happened there was, by the time when they applied and by the time we sent out the award, they had found other funding. So they returned our funding. We were able to fund 25 municipal governments for a total of $1.1 million. Originally, the allocation was $823,000. So along with tier 2, there was 2 municipalities that were interested in applying for funding. We were able to accommodate that. We were also able to provide some additional funding that was declined with tier 1. So that's why there was an increase for the municipalities. Then KDIC was funded $151,000, and that was for the recovery specialist, KDIC's staff time working on the grant program, and also the 4 chambers time working on the grant program. And then finally, the county government. This is the county itself. We were able to fund 41 county projects And we broke it down to some major categories for you. Obviously, if you'd like to see more detail, we have it, we can provide it. But we have $1.7 million in salary and benefits. So $200,000 was allowable under the CARES Act that we could retain. That was the task force time. We were able to fund employer paid sick leave. Was the sick leave when employees had to be off because of COVID. We were able to fund 50% of our unemployment costs. We were able to fund the premium pay that was paid to employees for coming into the office. When COVID first started, county offered a 25% premium. We were able to fund that. We were able to fund the hazard pay, and that was the salary and benefits when the county was closed those first couple of days when the governor announced the shutdown orders. We were able also to fund the nursing home premium pay. There was $1.2 million in technology upgrades, and that was really to accommodate work from home. So that was the purchase of laptops, the investment in Zoom and Office 365. That was the conference room upgrades. There was several of those, and some audiovisual equipment, purchasing of microphones and speakers and those types of things. The building upgrades, we had $500,000 in building upgrades, and that was mainly HVAC upgrades to improve air quality. There was $24,800 for building disinfecting. Kind of when COVID first started, maintenance was using an outside vendor to come in and do disinfecting of buildings. That later switched to our maintenance staff taking it down on themselves. So we had $500,000 in purchasing equipment. That was purchasing UVC cleaning equipment for the nursing home, electric static sprayers for maintenance to go around and fog the buildings. The prison bought a body scanner so the guards were not hands-on, some hazmat suits for public safety, and then a forklift and a pallet jack to move all of our COVID supplies that we purchased. We had $29,000 in policy improvements, and NHR had to make some improvements to our policies because of COVID. There was $412,000 in PPE, so that's anything that goes on your body. That's the masks, the face shields, the gloves. And we estimated that we tried to create about a year's stockpile worth of that stuff. And then about another $400,000 in disinfecting and cleaning supplies. Same thing, we tried to create about a year's stockpile worth of hand sanitizer, Clorox wipes, disinfecting spray, those types of things. Then $120,000 for COVID testing and vaccine clinic support. That was tents, shelters, heaters, tables and chairs for public safety. And then just another $42,000 in miscellaneous costs, some supplies for people working from home, some about probation, electronic monitoring devices, those types of things. So that's the county's $4.9 million. That's kind of our recap. Any questions from the board?
I kind of do, but it's an indirect question, and I don't want to take by surprise with it, so maybe something we need to think about for another day, but based on our experience here, I would like for us to think about what lessons we may have learned here that can be applied to the next process for the Recovery Act monies. What did we do right? What did we maybe need some improvement on? What's directly transferable to that exercise versus what's not? So I'm assuming we feel we learned a lot from this.
Absolutely. And I think one of the big things with the money that's coming, so we have a lot more time. You know, we had to pull this together very, very quickly. And so moving forward, coming up with criteria will probably be important. You know, what are the board's priorities with the money? We have a little bit more time to sit back and see what else is going on, and to put money maybe where there's not funding in another area. Like, for example, there's a lot of money coming out for child care. You know, that may not be something we wanna also, I'm not saying we don't have to, but I just saw there's a big blurb of how they're gonna put a lot of money into childcare. So finding something that's not being funded somewhere else that's lacking funds would be probably a priority, I would think.
Let me jump off of that, because you did make a reference during one part here with the, in terms of the small business support that we did, that we have a number of folks who essentially refused to sign the contract for whatever reasons, and I don't know what those are, but, you know, they obviously had some other means to survive, because I doubt very few of them would just object ideologically to a handout from the government and use that as, and then let their business slip out of their hands. But, so they must have had other reasons and presumably had other means available to them. So my question is, do we have a mechanism, how do I put this? They obviously didn't need it that badly. So how can we ensure that money we allocate going forward is really going to those who have no other sources, and that way, you know, maximize the impact we can have with the dollars we have where it's really needed, instead of making it available to folks who perhaps don't need it.
And that's really the tricky part, because there's so much money flowing. And so I think having time to look and see what other monies are flowing, so that we have an idea of what's available. And try to pinpoint the areas that have shortfalls,
You know?
and provide funding for them. Some of the businesses that didn't want to sign it, I mean, when you sign for federal dollars, you have to follow the federal requirements, and they're intimidating.
Yeah.
They're very intimidating, and a lot of the businesses, when they realized that it was taxable, and you can't deduct the expense, because they gave you the money for the expense. I mean, there's a real big tax impact with that.
So it's possible they're actually losing out by taking it versus just not having it.
I don't think they necessarily lose out, they just have a higher tax impact, and they just didn't feel it was worth that tax impact.
Right.
I mean, I don't know what their percentage of taxes, but if they have to pay 50% of it in tax and you get 50,000 free money, I don't know. But they're used to, if they spend that 50,000, they can deduct that 40,000 expense, and they can't in the
Mhm.
cities. And I'm not a tax expert, that's that's.
You'd be making a heck of a lot more money if you were. Wouldn't we all? No. Okay, that's helpful then.
Okay, are we ready to go for the fund balance? So normally I do this part of the presentation at the end of February, early March, but we were behind this one working on the other things, so I sent an email, but I wanted to follow up and make sure you had the formal presentation. So we're ending the year at $37,975,000. We estimate that to be 141 days of fund balance. I have a little caveat in there. Normally, through the year, we don't consider any budget resolutions for the general fund. This year, we had a substantial amount, and so the 141 days includes all the budget resolutions. If we did not have the budget resolutions, it would have been 150 days. We're still in the green part of the fund balance thermometer, so it's not really material. But if we would ever get into a time period where it shifted from whether we were in the red, yellow, or green, I think it's important to just put it out there. The fund balance increased by $3 million from 2019. There's a few major things playing into that. One is substantially the CARES Act. And so the first part of the projections that I'll go over is what changed since the October 2020 projections. Our revenue increased $2.5 million, or 2.88%. The majority of that is related to the CARES Renew Cumberland that we transferred into the general fund, and that's $1.7 million. Department fees did increase in the last quarter, so we did go over our projections by $500,000. Expenses decreased by $428,000, and another one of the major factors is the transfer to the other fund balance classifications decreased by $1.2 million. We estimated that we were gonna move $648,000 into assigned, and actually, we moved $543,000 out of the other classifications into unassigned. And on the next page, I kind of show what actually occurred, because it gets very confusing when you're talking about the fund balance. So we increased the assigned by $199,000. We increased the restricted by $239,000. What the major change was, the prepaids decreased by $982,000, and we don't know that until the very last pay of the year, the last disbursement. That changes every year based on what's outstanding, and we have no way of predicting it. We have to do it that way. But it does create that hazard in our fund balance. The major changes since 2019, the revenue increased 5.5 million or 6.6%. Real estate tax was 1.6% increase, and the other revenue was 16% increase. And that was the election grant of 2.4 million and the renewed Cumberland transfer in. Our expenses increased $7 million or 9.1%. Salary was 2.9%. The benefits, 1.6 million or 14.7%. And two main players in that was the unemployment compensation, which we also had offsetting revenue for that, and medical insurance of $1 million. Operating expense increased by, from 0.5%, $115,000. The capital increased because of the election equipment of $3.9 million. Subsidies increased $1 million or 17.4%, and that's children and youth, $544,000, criminal justice, and 911. And the transfers and debt decreased by $417,200. Do you have any questions on the fund balance? If I could take a little overview, it's not in the presentation, but I want to talk about the nursing homes fund balance a little bit, because in June, our CAFR is going to be published, and we normally don't talk about the difference between what's published in the CAFR and our assigned fund balance that's shown in the meeting, but there are two material things happening this year that are going to show a $5.4 million profit in the nursing home. Okay? Managed Medicaid changed this year in 2020, and it's last year, I'm still in this year. And so what happened was they started advance funding our May 2022 payment, or 21 payment. So there's $3.9 million in revenue in 2020 that normally would be in 2021. So for our fund balance calculation that we do for subsidy, we left it where it belongs. But in our CAFR, it's gonna show that increase in 2020. And then the other thing is the retirement adjustment based on our investment earnings was about $846,000. So those two things are what's the major players in causing that increase. And then just a quick differential between what we do for the assigned fund balance in our presentations versus the CAFR. On the modified cash, our capital purchases are in if we purchase with cash. On the full accrual, it would be depreciation expense only. On modified cash for debt, it's both your principal payment and your interest payment. On the full accrual, it's just interest. And then the two major things that are happening now is the retirement and OPEB are not included in modified cash, but they are in on the full accrual. And then the IGT, I'm calling them the advance payments, they're included in the full accrual and not on the modified cash. So with that IGT, the revenue's in this year, but not the offsetting payments. So I wanted to forewarn you before the CAFR is published the next.
So let me confirm, the managed Medicare payment for 2020, we received in 2021. But we're gonna show in 2020.
We received money in 2020,
Yes.
but the county didn't make their May 2021 payment yet. So they advanced funded it.
Okay, so we're sitting with 5-point-some million that we're going to spend. We don't have the expense side of it.
Correct.
Okay,
Correct.
clear.
Correct. bunch of counties going, oh, look how much money we made.
Yeah.
No, they did not. And so, I just wanted to put it out there because
Mhm.
we normally don't talk about it because there's not much of a difference. But this is big.
Okay.
That's all I have.
Thanks for the update on that. Okay. If you have questions, we'll go on to item 4, and that is other business. So do we have any additional stuff the board to address today? Okay, at this point in the meeting is required to move to the floor for any comment from members of the public who wish to offer such comment. Do we have anybody? No. Here indicating anything, so that being the case, I'll entertain a motion for adjournment.
Move to adjourn.
Stand adjourned, thank you all.